story as I introduce Esly Caldwell II.
Yeah.
MD, MPH, what's MPH?
Master Public Health.
Semi-retired physician who's practiced in this area since 1978, the year I got married, still married. In the U.S. Army Medical Corps, he commanded headquarters in Company A of 2nd Medical Battalion Support Brigade, 8th Army Korea, Ken. Ken.
What's that?
8th Army Korea.
Yep, that's what I.
Did you know Hawkeye Pierce and those guys?
Hawkeye was a good guy, but he had a little hospital very similar to the one I commanded.
Oh, really? A MASH unit.
Then he was stationed at Fort Myer, which included Arlington Cemetery, which had been R.E. Lee's plantation. I got a story about that, but I won't bore anybody. He's been a member of Cincinnati Civil War Roundtable for about 3 decades. See, I guess that's better than saying 30 years, isn't it?
It's about that.
And given talks there at NKU and DeVue Park Civil War celebration. Dan, you ought to get the man's information for
Battery dates.
Battery Cooper days.
I'm sort of ready. Got a technical thing that it's like talking about losing your legs. I got cut off here. So it's going to be a little bit tricky, but I appreciate you coming out. And the fact that there's a technical delay, we'll just have to ride with it. My outline is in my slides, and I had the slides set up so it's an outline of how things are. What I'll do, though, is I'll see if I can entertain you with stories of the Civil War and stories of the medical corps. And we'll wing it. It won't be quite as detailed and all the different kinds of things that I would if I could show you my data, because I won't remember all those details. Anyway, let's talk a little bit about the Army and Civil War. When the Civil War began, the doctors weren't all sympathetic to the Union. And of the 30 docs that covered 16,000 soldiers, about 12 of them went, and about twice as many assistant surgeons. The commander, the Surgeon General, was an old guy who was he'd been appointed Surgeon General by President Adams, a good bit before Lincoln.
Wow. Hopefully Quincy Adams?
Yeah, Quincy Adams, John Quincy, not John. John was here before that. But he was Quincy, but it was, anyway, so he was a crusty old guy who thought the biggest thing about the Army was saving money. For example, he thought having a book or a full surgical kit was a waste of money. Anyway, he lived a short time after the Civil War and died right before the age of 80-something. He was replaced by one fellow, and eventually another group of guys, the Sanitary Commission. Let me talk about the Sanitary Commission for just a second. Sanitary simply means clean. The Sanitary Commission meant that they advocated clean. No poop, no dirt, organized, made some sense. I had a beautiful slide with some other stuff, and I'm so sorry I don't have it, but anyway, I'll keep referring to it. So the Sanitary Commission learned from the Crimean War, was it Barton, I think, founder of the Red Cross.
Florence Nightingale.
Yeah. Anyway, she found out that she could significantly reduce disease by washing things, by cleaning things. Now, remember, there was no running water. And if you wanted water, if there was a well handy, that was good. Otherwise, you got it from the stream. So clean was not a simple task. You had to get the water. If you wanted hot water, you had to boil it. They did not know something that all of you know very well. There's such a thing as germs. That was unknown. The idea of infection was sort of available. They knew that you throw the lepers out of town. The people who had significant skin disease and smallpox would run around in the community, and you could stick those people and isolate those people. If you isolated them fast enough, you could prevent it. And also, they had smallpox vaccination. Sort of proved. They took the scab, when they gave a vaccination, took the scab off the vaccination, chopped it up and gave it to a bunch of other people, and took some of those scabs and passed it on. Not knowing germs, you got a few other kinds of rashes like infections and other kinds of things. And I don't know, nobody knows that hepatitis or some other kind, or syphilis, some other kinds of infectious diseases that could be transmitted by blood. Nobody knows if they got those because they didn't know how to check any of that stuff. Anyway, recruits, when they came, well, maybe I should talk to you a little bit more about medicine, about the physicians. With the onset of the war, particularly with Charleston and the harbor and the need for thousands of guys, there was a need for physicians. Now, I plan to start off a little bit different. The purpose of a soldier, military man, a warrior, is to take and hold ground against all comers. That's his job. That's what he does. What's the doc do? He makes sure the guy's healthy enough so he won't keel over from disease, etc. And in the last 100 years, 150, almost 200 years, we've been concerned about fixing them. When the Roman soldier got zapped or got hurt, or actually in the war, in the Revolutionary War, you got hurt, and your family didn't come get you, you just died right there. Put that in the case of a slave who just got elected to the Congress, but both legs amputated, blown off in either Iraq or Afghanistan. She would have just, of course, she would have lasted 10 minutes or 20 minutes. And even if she got it happen right out here, But anyway, that's the modern thing. So, for these archaic old guys, there was a need to find somebody who could bring in docs, physicians. Now, many times the physician of a division or a regiment was raised, the woman was raised, say, here in Alexandria. The politician would appoint a doc. Now, physicians, there weren't very much criteria. You could work with the doc, apprentice with the doc. You could just hang out a shingle. There were all kinds of docs, homeopaths, and botanists, and hydropaths. Okay, homeopaths, there are two kinds, but one the most common, the one that's still extant, so they treat like with like stuff. So if you have diarrhea, they give you a laxative. But they do, though, they don't give you a full laxative, they give you a little teeny, weeny dose. They dilute it out a lot. And that by pushing you more toward diarrhea, your body corrects back. The hydropaths use water therapy. You take baths and swallow it and all that. Well, and then there are the botanists that sort of like our herbologists or naturopaths today. They use a lot of herbs and stuff. And so anyway, that was a sort of the lay of the land. And there were a lot of people out practicing medicine. In this area, we had a medical school. University of Cincinnati's precursor already existed. And there were medical schools everywhere. A lot of the medical schools were associated with universities, like quite a lot of them in the north. And in the south, there were like half a dozen or so medical schools. At the outset of the war, they all eventually disappeared, and there was one. It was basically run by the Army. The Surgeon General of the Confederate Army organized University of Virginia Medical School, and they were turning out several hundred docs. In the north, they had a lot of medical schools that were turning out docs as well. But these docs had a term of like, they took 2 terms, like a 6 months or a 9-month term. 2 of those, and they graduated. And they were required to do an apprenticeship. They go and work with the doc. In the South, they were attached to Chimborazo Hospital, Chimborazo Hospital, the one in Richmond, the largest hospital in the world. At that time, it was the largest hospital in the world, 8,000 patients. It was basically a city unto itself. Its own water supply, its own dairy herd, its own farm, its own bakery, its own ice house, its own everything. And for 8,000 people, it was 8,000 patients. Staff probably was somewhere similar to that, or maybe more. It was a significant size town, the hospital was. And the medical director of the hospital was in charge of the medical school. And so they got practical experience right away. And the North was a lot more helter-skelter, and we had a lot of volunteers because they were bigger and had a lot more docs. I brought in a couple samples of stuff because one of the things I was going to talk about, well, there are a bunch of things I want to talk about, but one of the things about the docs that you guys were wondering about is, was any of this medicine any good? Okay. And I brought, on the table back there, I brought a bottle of quinine water, tonic water. Tonic water is basically quinine, which we still use, and which still works. In fact, for some type of malaria, it's the only thing that works. We still haven't fixed malaria. The other thing I brought is some stuff called blue mass. Now, blue mass, also called calamine, is bichloride of mercury. And the docs really, really like that one and tartar emetic. Now, if you walked up to the doc and said, "Oh, doc, I got my," whatever it is, "oh, my toe hurts," and "oh, I can't hardly walk, doc." Doc said, "Well, we can fix it." He's in his pocket, take a pinch of the stuff and stick it on his tongue. They know about germs. Stuck it on his tongue and said, "Okay, you all right, go on, get better." "Doc, I got the diarrhea." "Woo, I got the diarrhea, doc." Put this stuff on. Well, if you had the diarrhea, if you did not have the diarrhea, you got it. This blue mass was something they call a saliva. Oh, a few doses of this stuff, and your tongue would hang out, and you salivate about somewhere between a pint and a quart of spit a day, plus diarrhea. Yeah, it was some rough stuff. But the docs thought it fixed them now. They may have been mistaken, because if you ever got a dose of it, anytime you saw him, "How you feeling?" "Great, doc, great." I don't want any more of that medicine. Anyway, I brought that in. Other thing that's still used is, how many of you guys have ever taken Paracord? Paracord, that's the stuff that you buy from the drugstore that you just sign a little thing for.
They put that on teeth.
Yeah.
I think my mom used it on her.
And you can stick your finger in it and calm the baby's cramps down, the baby have cramps.
Yeah.
Or if you have diarrhea, it stops diarrhea.
Yeah.
But Paracord is camphorated tincture of opium. And one of the things I brought was a picture of an opium flower. It was grown locally, and an actual bud, a little opium bud. Because opium was really, really common. And the one they loved the best, the soldiers liked the best, booze. Lots of it. And almost any time they did anything, booze was part of it. Now, sometimes, a steward or somebody else who had access to it might use a little extra. Occasional doctor would use a little extra, would take some tonic, that kind of tonic, or booze tonic. Anyway, it was those are medicines, though, that are still used. Now, you also heard about bleeding. Scarf, where you put the suction cup on. Well, we still do that. In fact, I have prescribed that. Now, I cheat a little bit. I send them to Hartsburg. But there are diseases where that's the treatment. Too much iron, too much blood. That's the official treatment for it, to bleed the person. And Hartsburg is nice enough to do it. And I just tell them how often I want it done. And I check the person to see if it's working. The other therapy that's still extant, I'll tell you a little story about this one. I've heard it was said, some people said it was Chattanooga, but I've heard it was a military prison, a Confederate prison at Nashville. That's what I heard the most. But anyway, where it was. The captured Confederates had their own position. And so, one of the nastiest things you want to have is maggots in your womb. Ugh. You look down at the wound, and the little guys are crawling around and carrying on. The docs don't like it, the nurses don't like it, the patients don't like it, the family doesn't like it. Nobody likes watching those little guys. And so what they do, they pour a little chloroform on it. The chloroform fixes it. Incidentally, that's another drug that was used, started about 1851 or so, and was in widespread use in both North and South. South, when they could get it, in the North, all the time. Occasionally, ether was flammable, and a little bit more difficult to work with. And I'll talk to you about that a little bit, like using it for chloroform for surgery. Anyway, that's how they treated it. So the southern physician said, hey, look, we got all these maggots from these infected wounds and stuff. Let's have a little chloroform. You guys are traitors. You're tearing up our country. You want to do all this bad stuff to us? No way. Not going to die from the maggot, just suffer. You watch them, let everybody just watch those things. Well, one of the best kept secrets in the Civil War was maggots. Maggots don't eat live tissue. They only eat dead tissue. And they did a better job of carving out the dead tissue than any surgeon could do. And they could get back up in the little places and clean them out. And when they finish eating, they fly away. Anyway, that secret didn't get out of the South. During the war, it came out, Spanish-American War, like a generation later, that maggot therapy. And in Cincinnati today, you can get maggot therapy. Now, there's certain places and certain uses for it. The other one that's still used is leeches, bloodsuckers. Yeah, you can get bloodsuckers. There are only two things bloodsuckers will do, or that we're using for today. One is for black eye. You get a pretty girl going to the prom, and she stumbled and bumped into something, and she got a black eye. Or she punched a pimple on her face, got a black eye. How you get rid of the leech? If she'll let you. Most of the time, they're not going to hook that thing on their face. I don't think they'll do that. The other place, the hand surgeons use it. When they do a skin graft on the finger, and it gets a little blood out of it, that compromises the graft. And you can't get that blood out of there with any mechanical mechanism. You can't suck it out with a needle. You got to stick it and try to stick it and get it out. But you put a leech on it. The leech will suck on it, and the blood's gone, the leech will fall off. So today, those two things you can get. Those are things that you can get today that are kind of interesting. Well, I told you that from the recruit standpoint, let's talk about the soldiers just for a minute. They had a pretty hard life. First of all, you take a guy from the farm down here, down the road here somewhere. Kids, because most people ever seen at one time, maybe 20 people. Go to town, you might see 20 people. So things like whooping cough, chicken pox, measles, that sort of thing, he had no exposure to it. So you get 1,000 of those guys, you put them in a place, and one comes in with chicken pox. Everybody got it. Whooping cough, everybody's got it. So today we have other things. When you walk into the Army, when you walk in on day one, you're immunized if you don't have it already. And sometimes, even if you did have it already, if you can't prove you had it, you get it again. The Army doesn't mess around with that today. But that didn't exist then. And so those were regular childhood illnesses that we get, that we talk about now, were a big deal. The second thing is, everybody got diarrhea, like a million cases, or some outrageous number. There's 1 unit, 1,000 guys, and 995 of them got diarrhea in 1 year. That was just one record. So when they talk about guts, everybody talks about guts, they think that means courage. In the Civil War, that means just having intestines that could stand it. They could get you through it. Anyway, well, you live in a little tent that's basically a little thing that goes up like this, open on both ends. So what you do, you got the trots, and you got to go in a hurry, right outside the tent. Okay, hey, and so pretty soon those tents were pretty messy. And they built, the Army's camped on the sides, on the banks of these rivers, because they had to be near water. A little bit of rain, of course, got pretty smelly down in that water, and the guys downstream were drinking some awful nasty looking water. One of the things the Sanitary Commission proposed, and of all the people, Little Mac McClellan was one of the first ones to adopt it, was a thing called a sink. A sink is a straddle hole, a couple of feet wide, something like 6 feet deep, maybe, and 30 feet long. That was the diarrhea place. And they enforced it. Now, once they started enforcing it, of course, it got a little messy on the sides. And every day they were supposed to throw fresh dirt into it, so they'd fill up one and go to another one. Anyway, that cleaned up the diarrhea in the camp, and remarkably, diseases, many diseases went down, among others, diarrhea. Of course, you got to walk in it, got to sit around and poop, a couple of days later, the diarrhea soaked into the dirt, you don't recognize it. Oh, it could be really bad. Anyway, those are a couple of things, of course, they were poorly fed. Very, very poorly fed. They, the staple was for Union soldier was one of those hardtack things, a flour and water biscuit, was about that big, about that thick. They say that in the dark, though, sometimes they had protein on them. The little weevils get into them. And the guy said that some of the soldiers' correspondence talks about the protein or the animal matter in those little biscuits. And coffee. There's one guy that said if you had your choice of one thing that you could carry with you and that would fix everything and was just the best thing in the world, he said it was coffee. Now these guys, coffee, they had all kinds of ways of cooking. At one time there was a command throughout the army that they cooked by companies, but when they got into combat or they got into moving or something, it might go down to platoons or even down to squads for cooking. And the cooking generally was frying it in some grease, because you also got fat back. Sometimes you get beef. But, there are no veggies. There was a thing at some places that there was a desiccated vegetable thing. I think had some kind of greens, carrots, and some other stuff in it, maybe potatoes or something. Another time somebody thought potatoes would stop scurvy, and they were giving it out. But, from the tales of the British Navy, the Lions, that scurvy or vitamin C deficiency, which causes bleeding in the gums and diarrhea and poor tissue, very poor repair. So things like recovering from surgery or being ill, or just dying from death, can be fixed with fruit, lime, a little hard lime they carried on the ships. And there were many episodes where that was the case. Now, the Southerners had a little different diet, and I forgot it, I had it written down on the slide. Had a little different diet, was not even as nutritious as that. And the diet, there were several times, several battles. The one I remember most of was Shallow. You remember on the second day, the Union Army came in on the second day, they pushed in and they were ahead, and then I think Johnson and somebody else came up. And on the second day, at breakfast, they overran the Union troops. They ran up, they came in and they attacked at breakfast time when the guys were sitting around trying to eat. Well, those Confederate soldiers hadn't eaten for days. And you come up on a guy having breakfast and he runs off and leaves the breakfast. You're not going to chase after him, eat first. And so that broke the momentum of the Confederacy for that in Charlotte, the second day, and even though they won. And that's when Grant said, another German told Grant, oh, they beat us. And he said, yeah, but we'll beat them tomorrow. I don't know if you heard that story.
Sherman told Grant.
Yeah, well, Sherman, okay, yeah, I know it was another general. Anyway, yeah, we'll look at tomorrow.
Right.
Anyway, so that's the food element. Now there were several other pieces to the medical story, both north and south. The qualifications, I told you about going to medical school and how there were political docs and stuff. It took the Union Army a couple of years to try to fix that. And they got to where they would have these boards that would examine people. Then people who thought they knew a little bit, like some of the stewards were actually pharmacists. Most of them were pharmacists, or a lot of them were pharmacists. And they would get a little bit more pay, and they would, be a surgeon, assistant surgeon. And so they'd take the exam. And there's one story of one guy who went. And the questions could be very difficult. These boards asked, so you had to pass the board. And you had basically an oral examination. And the Union Army toward the end had primarily graduates of a medical school plus an apprenticeship. And the quality of the position was markedly improved. Now, or to tell you another story about the blue mass. Hammond was a Surgeon General for the Union Army, and he was a really spectacular administrator and physician, and he changed the character of the Army. One of the things he did was appoint Letterman as the medical director, Jonathan Letterman, as the medical director for the Army of the Potomac, at a time when Little Mac was in charge. Now, Little Mac didn't have, which is, okay, some people will call it stones, other people will call it other names. But he didn't have it. You know, everybody knows about the Quaker guns that frightened. I'm sorry. Lee wanted to scare, for those of you who don't know about the Quaker gun, Lee wanted to keep Little Mac from attacking. And so he sent a small bunch of guys over to fake it. And they had big poles, big logs, painted like cannons. They call them Quaker guns, because Quakers are pacifists. These are guns that were actually fake guns. But you cross the river, they look like guns. And Little Mac never got a nerve enough to attack to find out. Anyway, but Little Mac did a lot of things that Letterman suggested and revolutionized transport and organization of the medical corps, because he backed his medical director. And so we got a lot of things that are really, really pretty spectacular as far as transporting. There's a lot of trouble trying to figure out, I wish I'm breaking, I keep missing those slides. Anyway, trying to find a proper ambulance. They tried carrying guys, they tried horseback with some contraptions with stretchers on the horseback. They had 2 wheels, and ultimately they wound up with 4 wheels. There were several problems. One, the quartermaster controlled them, and he had to get permission. And then sometimes officers or somebody would commandeer the ambulance. So they didn't have to, the ambulances would be missing. And they never did, very seldom did they give them enough of it. So there were a lot of problems with ambulances, trying to figure out what was the best one and getting them organized so that they could carry wounded back and forth. Well, the other problem, there were many problems that and the South never did conquer it. But the problem of parochialism, the problem of, I'm gonna hang out with my Kentucky guys from Northern Kentucky. And the doc wouldn't see the guys who were from across the river or Western Kentucky or from Tennessee. Or they wouldn't, the division that came here only take care of their own division. But what he did was, he organized it so that they had field hospitals. The organization, by the way, that he had was more or less intact for another 100 years. I was in the Army 100 years after the Civil War. I went in, I told you when you introduced me, 1965 was when I went in. So I was in 100 years after the Civil War. Exactly 100 years. 50 years ago. That's some history too. Anyway, they had the regiment. The regiments had a doc and a couple of assistant surgeons, and then a squad of guys who stretcher bearers. And the assistant surgeon would be close to the front. The surgeon would be back a little bit. That's every regiment. And then what Letterman did was he hooked them into brigades. And so the docs were in the brigade. And he had it set up so about 1 in 15 did the surgery. Not every surgeon. They had assistant surgeon in the brigade hospital. One surgeon did the surgery, 1 out of 15. Then they had a guy who kept the records. That was his specific job, an assistant surgeon, qualified physician, only did that. Another guy kept up with getting enough medicine, enough food, enough supplies, all that stuff. And there was another physician, I'm blocking what he did, but they had the jobs divided up. And when it started off, there was everybody wanted to cut. Nobody knew how to cut, but everybody wanted to cut. But they only wanted, they limited the guys with skill. And of course you didn't have skill, you didn't demonstrate skill, you got bumped. Well, Then the division, the brigade entered the division hospital and Field Army Hospital. And moving back had ambulance trains. And eventually, the Army had dedicated, for a while they had contract people who were like at Bull Run ran away. You know, they had ambulance drivers, contract ambulance drivers. And other people, they just disappeared. Or the ambulances got commandeered by people getting out of Bull Run. Anyway, that was a major thing. And when I was in 100 years later, it was similar. Battalions had a surgeon there. And then, like, I was at the brigade level. My company was back at the brigade. I had a little hospital that looked like MASH. All my equipment, just like MASH. MASH messed me up. I look at MASH and I think I'm home. Anyway, so he organized the ambulance corps, got ambulances dedicated, ambulance drivers dedicated, and the physicians were required to drill the ambulance drivers so that they knew on how to load the ambulances. The other thing was that the North did was that they got a very highly organized system for bringing wounded out. They would they get to the brigade hospital where they did either primary or secondary intensive surgery, and that was a bone contention. It probably still is. When the guy comes back, whether they're doing amputation now or later, then there were two types of things they did. One was just sort of like a guillotine with a little bit of more meat than bone. More bone than meat, that's a problem. But more meat on the outside. The other one was to leave it flat so you could flap it over. Maybe to have a skin with a little bit of fat on it to flap over the end of it. Whichever arm or leg. And the higher the amputation, the worse the problem, the more people died. Everybody who had anything got infected. If you haven't had a bad luck of being at Antietam, where one of the hospitals was a barn, because the germ that causes tetanus is in horse poop. It's carrying horse intestine. And so if you happen to be in, let's say it was like a foot deep in that barn, if you happen to be one of the people, now a lot of the surgery was done outside because the light was better. Okay, and I talked to you about a little bit about anesthesia. Okay, of course they didn't have anesthetists, people who were trained to do anesthesia. What they do was put a little cloth cone on the face and drip it in. When the person went out, all the way out, surgery started, and those surgeries were quick. You could take a leg off in what, 5 minutes, 10 minutes. They didn't waste any time. And of course, they didn't know about sterility, so nobody washed their hands. And guys that hold a knife in the mouth, of course, got to put it somewhere. Yeah. And you put it down, you know what's going to happen. And they shove these guys out, put a leg out the window, and shove the guy off, and move the next. When that leg was gone, next! And everybody would. So they were doing them. They guys who were cutting off limbs like up to a day and a half, 36 hours and more, without sleeping. Because after the battle, they just kept on working. Then,
Did they try to cauterize the wound or anything?
No. Cauterize? No. Yeah, they inflamed the cauterize.
Yeah.
And took time to heat that thing up. No cauteries, no nothing. Now, what about bleeding? Okay, there were several ways of fixing bleeding, and some of them. Okay, one of the things you can do was stick your finger on the artery. There's one story where they were doing shifts. Every 30 minutes they'd change the nurse or change whoever it was to hold that artery to it clotted behind it. Sometimes they would do what's called a ligature string. They'd put a string around it, use horsehair, they could, use linen, cotton. Tie a string on the artery, on the vessel that's bleeding, and leave a little tail outside. And when you go in to dress the wound, pull on a little bit. When it rotted off, they didn't bleed you good. Sometimes the person would bleed to death. Anyway, what happened was they all got infected. Everybody. There's a thing they call, you'll hear about it, laudable pus. I love the phrase, laudable pus. That's good pus. That's when the pus, when the wound had separated and it had come to a head and was ready to burst, and when the pus came out, the person's going to get better. They call it laudable pus. But anyway, whatever kind of wound you had, now stop the bleeding. I told you, dirty fingers and the ligatures and tourniquets. Now tourniquets, what about tourniquets? That was controversial. tourniquets work, but you got to turn the tourniquet loose at some point, and then you have to find a place where it bleeds. But if acute bleeding, it's no big deal. The lady I was telling you about that just got elected to the House, if somebody had to put a tourniquet on his leg, she'd bleed away in minutes. So clearly she had, whoever was close by put tourniquets on, and she was off them, pretty quickly. Anyway, during the Civil War, of course, none of that stuff was available. But they did have tourniquets. And so for some wounds on the battlefield, that was life-saving.
Some of the ligatures were horsehair.
Yes, yeah.
From the tail.
Yeah.
That's not the cleanest part, is it?
Yeah. Horsehair is pretty good because it's a solitary string. It's solid. Doesn't tear easy. Doesn't break easy. It's a great ligature. Yeah, you might wonder about the horse poop being on it, but it's that was not a concern at the time. Okay. Anyway, the transport went back, and they were highly organized trains and ships and really, really superbly organized hospitals. I told you about Chimborazo. The Union had several hospitals that were big, 6,000 maybe, not quite 8,000, and they didn't have a medical school attached. I don't think. They may have. Yeah. Okay. There were. Okay, I'll just tell you some little tidbit tales. A couple of them. One time, one guy was laid out on the battlefield after the battle with his intestines on the ground. And a couple of docs drove by, and I saw him. He said, "Hey, where you guys going?" I said, "Well, we're not bothered with you. You were dead then. You're going to be dead before we can fix you. We don't know what to do with that." He says, "Well, I'm an officer. You got to help me." And so they went back, picked stuff off, dust off the grass and dirt, took him over to a farmhouse. Lady was at the farmhouse, and she had a needle and thread, and they sewed him up on the kitchen table or a door or something, sewed him up, and kept on going. 30 years later, he finally did croak.
So they were right, he's a dead man.
Eventually. He probably outlived all of them.
But apparently the intestines, though they were out, had not been broken.
Exactly.
All they had to do was put them back in.
Exactly. And he
because
recovered
they
from
were
germs.
not broken.
Yes, if they had been broken, and he would have peritonitis and died. So it was a superficial wound, and a superficial wound, deep enough wound for the intestines to fall out, big enough and deep enough, but not enough, but the intestines themselves went on. Amazing. There are all kinds of stories. Okay, but anyway, about out of the things I can talk about spontaneously, and
Question.
Yeah, question.
Around Memphis, I had read something where a lot of soldiers were messing with the not nice ladies.
Yes.
And a lot of
Yeah.
them caught diseases.
Yes.
And that was a big problem
Yes,
too, as medical
well,
had to deal with a lot of that.
that's always been a problem with soldiers since they've been soldiers. And the Civil War and any other war is, that's true. Like where I was stationed, there were 1,200 soldiers, 1,800 ladies. And so, yeah, that's always been a problem. However, the treatment was worthless.
So they had to really have.
They didn't have good treatment. They recognized gonorrhea and they recognized syphilis, but not any other disease.
And actually, more soldiers, more military people died in the Civil War from disease than they did from actual
By far,
gunshot.
by far. Among the black troops, 33,000 deaths, 33,000 deaths, and 2,000 were from combat.
Wow.
And among the white troops, it was, I think, 2. Wasn't quite that bad, because the black troops had, much worse conditions going into the war.
Esly, would you talk about the nurses in the Civil War?
Oh, nurses. Okay. Yeah. Okay. Nurses. Okay. Nurses. Well, there were several different ways. Okay, we'll start off early in the war, and in most military places, the nurses were recovering soldiers who were too sick to go back to duty and not sick enough to go home. And so if they could hobble around their job was helping the other soldiers. That was common. The steward was usually a pharmacist and was a one skilled person there, like a master sergeant or something. Later, there were in the bigger hospitals, like Brigade and back, occasionally further, they had women. Sometimes middle class, upper class women, sometimes black women. Black women usually had a little lesser job. The nursing, though, was done, and there was actually Dorothea Dix organized the nursing corps. The thing that I liked about her thing was, she said the people she recruited, the ladies she recruited, had to be plain looking. Couldn't be pretty. Could not be pretty. And she would reject the lady who was pretty on that basis alone.
It makes your blood pressure go up, trust me.
It made her blood pressure go up. But she was
No, I'm talking about the pretty nurses made the blood pressure of the patients.
Oh yeah. Well, yeah, and there were good reasons for that. You got to recognize this is a Victorian era.
Oh, yeah.
And any hanky-panky was not tolerated.
No.
And the suspicion of hanky-panky was not going to be tolerated. And so that was, anyway, Dorothea Dix organized it, and there were, so her nurses actually went around, there were all kinds of conflicts about her nurses. I think this movie, there was this TV show, had a little bit of her, one of her nurses, some of her nurses interacting. The other group of nurses were nuns. The nuns were very, very well known for the quality of the nursing, and when they went into a place, they of course cleaned it up, which improved conditions quite a bit. And they almost by definition, nuns are caring people, and so the soldiers would feel the warmth and the care, and they would feed them and clean them and all that stuff, write letters, all the things that they did. Consider, they didn't know about germs. Surgery was a little bit of surgery and care for patients suffered from not knowing about germs. They did know about contagion for things like smallpox and some other diseases. There was one they called hospital gangrene. And I've read several conflicting stories about it. The one I thought was that what we talk about now is the flesh-eating bacteria that goes up and that was often fatal. There was a treatment for some forms of it. And what they did was they opened the tissue and treated with bromine. And apparently that stopped the progression of it. That was a treatment that I've seen written someplace. I only had one person with it, and he was pretty sick. Survived, but very sick. With the streptococcus. There's some other kind that people pretty regularly die from. You see it in some feet where there's little bubbles bubbling in the skin. That's the type of gangrene where they have to, they move people when it's contagious or looks like it's contagious or going to a ward. They move everybody. It looks like they have it off into a special place. And they have special crew, special everything to do that. Yes, sir.
I wonder about some of the logistics of after the battle. I mean, did both sides then just send their stretcher crews out and then take their wounded back? Did they call a truce or what? I mean, so
you're asking about
it's getting the wounded off the battlefield.
Oh, getting the wounded off the battlefield.
I mean, they had wounded from both sides.
Yes.
So.
Yes, wounded off the battlefield. The ambulance crew that I talked to you about, and there were several things. If they lost the battle, they'd have to have a truce to get out.
Yeah.
In many battles, like in the wilderness battle, people were losing, were dying from burns from the fires and stuff that was there. And in other battles, where the battle where the South won, the North's wounded would be left on the battlefield. Now, sometimes the victors would take in the wounded, period. But they had trouble having enough transportation during a lot of the war, and particularly like when Grant was on his overland campaign. To keep up was a trick, and he had a lot of losses. There were meat meal or something like pushing people into the grinder, and all these wounded. Well, Grant couldn't stop; he's going to win. And so the medical corps had to try to keep up, and that was a little problem for them. And if they happened to lose, if the Union lost those battles they lost, then they would get a truce. That may take a day or so, and the guy would be out there on the battlefield. He'd have to have a not immediately fatal wound to survive. The battles, by the way, where were the wounds of the dead on the battlefield? The wounds were the head, chest, and abdomen. Limb wounds were very small, those on the battlefield. Who died immediately. Although some of those survived, some of those, if you got your intestines here, that was over. But you could have a through and through, or you could miss intestines or other vital organs, and then you could survive. And the chest, depending on where it went, you could survive. But that was where, and the weapons used. The number of weapons, the number of people who had knife wounds, bayonet or saber wounds, was really, really, really tiny. I know Chamberlain famous for at Gettysburg for making a bayonet charge.
Yeah.
But the wounds overall by a bayonet or a saber, and the officers, didn't carry guns, they run around whacking people with those sabers. They didn't do much whacking. Or if they whacked them, they didn't get much. They didn't get much care because there were very, very few. The other thing there were few of was from artillery. And mini ball was deadly. Before the mini ball, the smoothbore weapons were kind of deadly also. They would carry into the room cloth, cloth, skin, stuff on the outside. They carry all that into the room. And so, as opposed to mini balls, they have high velocity weapon. When it gets there, it's already so hot, it's going to burn up everything, and it goes off through. Yeah.
You were talking about the nurses before, and the Civil War here in Kentucky, and nuns. There was a nun, and she was loved by the rebels and the Yankees both, like if I understand. And she, I think, you know who I'm talking about, probably.
No, but I can hear she would, because they probably did take sides.
Yeah, and it was in western Kentucky somewhere, and she might have been one of the last deaths of one of the battles, and I just read something about that here in the Kentucky
There was
the Civil War.
There was a lady physician who got captured. I think there may have been more than one, but there's one famous lady, I think her name was Barker, who was she wore a uniform. She actually was in the army, and she went on the battlefield. She got captured because she wouldn't leave the soldiers on the battlefield, and she took care of some Confederates and some Union people. I think she was outspoken, and she was clearly pretty.
Did she get she the one that President Carter, he gave her she had won the award of some kind. What was it, that honor that they give the soldiers? And then they took it. Yeah, and then President Carter, when he was in, gave it back to her. He said
that was the controversy with that. What happened? She won a Congressional Medal of Honor.
Okay.
And Congress or somebody decided she didn't deserve it, and they asked for it back. And she said, "Oh, yours, buddy."
That was Mary Walker.
Mary Walker. I couldn't remember her name. Mary Walker. Yeah. She said, it's not going to happen while I'm alive. You take it off my body when I'm gone. Yeah. Yes, sir.
I have to go because I have to be at work early, but could I please, Doctor, if you recommend these, could you please prescribe and pass these over to this good man for the call?
Okay. I have some Smith Brothers back there too.
Oh, okay. Well, if the patient consents. Thank you very much.
We give him a little dab in the blue man.
Oh, thank you.
See you, Andrew. Thanks for coming.
Are there other questions? Yeah, I like that.
If people are interested in the medicine that might have been used, we have a local library called the Boyd Library, where you can get a lot of information on what botanical things we used in the war. And it's very interesting.
Yeah, it's downtown, and it's a really, really nice library. It's small.
Can anybody go there and do research if you want to?
Yes, anyone can go there.
Yes. Anybody can go there.
Oh yeah. You don't need to remember anything. It's very nice. It has all kinds of periodicals, it has books, it has exhibits, and a lot of information. So if you like botanicals, or if you're into the herbs, anyway, if you're into that, that's the place to go. Yeah.
John Wayne's movie, The Horse Soldiers, has him fighting William Holden, who was a doctor.
Okay.
And William Holden was able to put out a lot of information about medicine during the Civil War.
Yeah, you have to watch out for some of the stuff, like the woman doctor that was back, the TV show, The Woman Doctor.
Dr.
She,
Finn.
yeah,
Medicine woman.
yeah, I forget what her name was, but she wasn't authentic. The stuff she kept doing was she learned, the stuff she was doing was known a decade after, or 2 decades or more after, so after the period where she said she was. So she was a hero when she was clairvoyant enough to see a few years ahead.
I should have known that X-ray. That wasn't real, that X-ray that they did.
That antibiotic shit. Yeah. Any other questions?
What did they treat the STDs with?
I think, emollients and for maybe stuff they put in the penis or something.
Yeah.
I don't know if they treated ladies at all.
Mercury. Didn't they treat someone with mercury?
They might have done something with mercury. I don't remember exactly how they treated it. I can look that up. But I had an article on it. Like syphilis. Syphilis is a much more complex illness than they knew about. They knew about the chancre, but the secondary and tertiary syphilis.
What about post-traumatic stress syndrome? They didn't even think about anything like that back then.
It happens a lot.
But they didn't
Oh
really.
yeah, it happens a lot. When you look at letters and things from people who were in the war, there were an awful lot of people who had what looked like it. But no, that's a fairly recent phenomenon that we have recognized.
Yeah.
Like all these soldiers committed suicide and all other kinds of things. We have finally got to the point where we recognize that they need help. That just coming home doesn't mean you can't wear unwounded.
I think it was World War I before the term shell shock.
Yes, the term shell shock, that's a severe form. The shell shock is a guy who really is wiped out. But there are guys coming home who were less obvious. Like now, we have so many guys who have significant trouble readapting to civilian life, and they need a lot of help, more than we're doing, and actually probably more than we know how to do, because I think that there's a lot that we're not touching. The suicide rate among people who are coming back from the war, from wars that we're doing now, it's pretty. It's the fact that there's that many means that there are many war guys who are pretty sick who didn't kill themselves, and we don't even know how to find them, because we don't know how to detect all of that stuff. We will, because it's a significant problem. Hopefully, our nation will work on that. Yes, you have a question? Oh, is there another question? Yes, sir.
There's a doctor who's in one of the 5 statues that's in the rotunda there at the Capitol of Kentucky.
Okay.
But I don't think he's there because of what he did during the war. He was at the Battle of Perryville, but it was after the war. Do you know who I'm talking about?
No, but yeah, these guys kept on living, and quite a few of them did a lot of things afterwards. They were, and some of them went back. That's why, remember I told you about the maggot thing? Those are docs who, Southern physicians, who had a career, and when, they were Spanish American while they were American. Everybody was American after the war. So they went in the Army, or went back into service, and they brought with them that big secret.
And that was catch as catch can. I mean, they didn't really realize that was going to work out as good as it did when it did.
Oh no, that was when they figured it out in prison.
Yeah.
They were. I'm sure they were raising the ruckus and all kinds of stuff, and mad at the union and all kinds of things. And then when the guys wound, they looked at the wound and said, "Whoa, what's that?" And, it happened a lot.
Yeah.
And of course they're intelligent people, so they figured it out. It's the South had a lot of things they did, but they were good. One of them was they had a journal. They had a medical journal. That was good. I've seen some copies of it. It was very good and very well written, and had a lot of really good information in it. And I think it went for like a year or 2 years. And no copy ever got out of the South. One copy went to England. There was a copy that got out to England. That was it. That written material never got out of the South. So they were very good at keeping secrets. And some of them were very useful, like the maggot therapy was useful, and the journal was useful. Okay.
Yeah, you asked a question about transporting the wounded. There's a book, I think the title is Roads from Gettysburg.
Oh, so after the battle.
And the battle, Pickett's charge ends, and
Okay.
You got me thinking about
Robert E.
that.
Lee.
I'm sure, there's a lot of
back
books. Because they had to carry all those guys back.
Yeah.
Yeah.
Yeah. That would
And
be
one of
good.
the things they point out was these wagons had no springs.
Yeah.
Yeah.
Well,
The other book that talks about it, a chapter or two, Doctors in Blue, by a guy named Adams. And it's it has a chapter or two on the ambulances.
What got me thinking about it was, I was watching a documentary on D-Day, and they said that on the morning, on June 6th, the Germans were targeting the stretcher bearers.
Yeah.
Right across.
Oh, yeah.
So, but in the Civil War, it was a gentleman's game. You know,
Yes. In fact, the trains going from Sherman's March in Georgia, the train going back before Atlanta were painted red. And Morgan and Forrest didn't bother. They were one of the big things was disrupting railroads and stopping trains and stuff. Those trains are let go too.
If medicine were, say, back then anywhere near like what it is today, after Lincoln was shot, would he have possibly been able to survive at all? He wouldn't.
He got shot square in the back of the head and went through his brain.
Almost out, he shot in the back left, and it almost came out his right eye.
Yeah.
7-inch deep wound, Ken.
Yeah, somebody close went in and stuck their finger in it, but that was
Yeah.
probably didn't hasten his death. He was pretty much doing this. That's a pretty lethal wound. Yeah, people who talk about Garfield.
Yeah.
A lot of people say that Garfield might have lived.
Sure.
Yeah, given the time.
And McKinley.
Yeah, I think I read the story where the guy was making the case that Garfield should have better care. Yeah, I don't think so. I think that for the time, if you look at it, if you take information from a decade or two later, yeah, true. But for the time, he got the best there was.